This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
Okay, so our Consult With Me today is about pelvic floor physical therapy versus
Great.
surgery.
Yes.
Because, well, first of all, we see a lot of patients that think they need surgery, right?
50% of women who have had a vaginal delivery have urinary incontinence of some way, shape, or form.
Mm-hmm.
And that is the most significant effect of pelvic floor relaxation and pelvic floor damage. So it's extremely common. And it either gets ignored and people just live with it. And the symptoms are urinary incontinence, urinary frequency, nocturia, having to get up at night, and also vaginal symptoms as well in terms of relaxation, lack of sensation, and so on, are all made worse by menopause, but a very, very common problem for anybody who's had a vaginal delivery and most women later on in life as well.
But when you say like pelvic floor physical therapy, it almost like people are like, oh God. Well, first of all, what is that? How long is it going to take to work? What am I signing up for? So can you go into that?
It's almost like an exercise program. And
what are they doing?
In every birth class, a childbirth instructor will talk to the pregnant patients, about strengthening the pelvic floor,
so
doing Kegel exercises. Mm-hmm. Well, almost nobody does them or does them enough.
Well, why not just do the V-tone
instead of? Okay, so jumping straight into technology.
Well, I mean, I'm just wondering because
no. This is a great way to do it. Most people want instant gratification.
Yeah,
and if it's really bad.
I don't think I'd do it if somebody told me I needed it.
Just doing pelvic floor exercise is probably not going to be enough.
Yeah.
So if it's very severe, and the gold standard of treatment for it is surgery. Mm-hmm. But surgery isn't always successful, and there's a risk factor to it.
Right.
And things can actually be worse afterwards. So, and if you do pelvic floor physical therapy or some type of exercise there prior to surgery, it can help the surgery as well. So either as a standalone treatment, it can be helpful, or as an adjunct to other treatments. One of the ways that we can do that is using, as you mentioned, V-tone. Well, V-tone is electrical muscle stimulation of pelvic floor muscles. And so what happens is, in the office, using this electrical current, a transducer can be placed in the vagina, which will stimulate a muscle to contract. And it will contract and relax, contract and relax. And
I had it done.
In 30 minutes, you can get a tremendous workout to the pelvic floor. And that should be done once or twice a week for a period of 6 weeks. It's not expensive. It's invasive to the point of a transducer in the vagina, which is not uncomfortable. The contraction is fairly uncomfortable at higher electrical power settings, but that's adjusted for each individual patient. So it's not an uncomfortable procedure generally. It's not expensive. There's no downtime, no preparation time.
How much is it? Is it $250 a treatment?
$250 a treatment.
Mm-hmm. And so if somebody's looking at pelvic floor physical therapy, they should also look at V-tone.
Yeah.
And if somebody is considering surgery, that would be the mesh, right? That you used to do more of, right? Because we hear that a lot, or somebody had a mesh.
Right.
You're not doing meshes anymore, right?
Right. What
is a mesh? Explain that.
Mesh is essentially a nylon weave of material, which is placed in the area where the ligaments were or the muscles were and have been damaged by gravity, childbirth, lack of hormones, all the rest of it. Placing that mesh is technically difficult.
But you used to do a lot of that?
Okay. Yeah,
Okay.
and you have to do a lot of them to be good at it, or the frequency of complications is higher. It's higher among physicians, providers that aren't doing a lot of the surgery. So it's technically demanding, but these tissues can all these even though they're relatively inert nylon material, they can still be rejected by the body, and they can ulcerate through the mucosa and cause bleeding and pain for a partner with intercourse.
Are people using the mesh anymore? Or
Yeah.
is that kind of...
Yes, so people are using the mesh, but it fell out of favor probably 10 years ago because of the complication rate and frankly, the lack of experience of the practitioners. So if somebody needs that, they should be going to somebody who specializes in that. And there are urologists and gynecologists who specialize this, and they are referred to as urogynecologists, pelvic floor specialists. And that is a separate specialty of OBGYN and urology to get that training. So that's who needs to be doing the surgery. And frankly, I stopped doing it because I wasn't getting, and I didn't have enough cases to be as good as I felt I should be with this. There's some of the operations are easier than others, but a full pelvic floor repair can be a very complicated surgery.
So for the people doing physical therapy, pelvic floor physical therapy, what time commitment is that? How long before?
They would normally have a treatment, a therapy session with a provider, a physical therapist specializing in pelvic floor procedures. They have a treatment once a week or an evaluation once a week for probably 6, maybe 2 to 6 months, something like that. But they would also have the requirement of doing exercises at home. And one of the beauties of pelvic floor therapy, physical therapy, is that it helps patients to isolate the muscles. They can have better control by seeing a specialist of physical therapy. So great thing to do, not used enough, and partially, not used enough because the providers of this are few and far between.
Yeah, I know. And they're really hard to get into.
And they're hard to get into.
Yeah.
So the V-tone is
to go along with it.
Way, yes. Yeah, it can go along with it, but it can be used standalone.
Yeah.
Because as I say, it's hard to get into it. Now, insurance will probably cover pelvic floor physical therapy and probably won't cover V-tone. It will cover surgery most of the time. But I actually, when we started getting the technologies, the laser and the radio frequency electrical stimulation, that's when my surgical volume of these dropped.
Yeah.
And that's when I really stopped doing the surgery because I wasn't doing enough.
Right.
And I was happy to be able to do all of that in a less dangerous way.
Right. Okay, thank you. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.